Hello and welcome to another episode of Clean Talk. It is February 24th, 2023, and we are on site at the BAPIC convention. That's the Bay Area APIC convention. APIC, of course, the Association for Professionals in Infection Control. And we're here at the Clean Talk podcast, the podcast for infection prevention. I'm very pleased to have with me my guest today, John Guastella, who is with Surfacide Technologies. John, welcome to Clean Talk.
Thank you, Brad. It's great to be here.
Well, it's great to have you on the show. I'm very familiar with your products. I'm really excited to share what you guys are doing with our infection control audience. John, what can you tell us about your background and why you're on Clean Talk today?
Sure. Well, I've been in the hospital space for many years. I had a background in healthcare, worked for the American Heart Association, and then also did some work with some cancer research laboratories. And now being in the UVC space, the one common thread is that at the end of the day, I get to help affect a patient's life and make sure that we can positively have some better outcomes.
Prevent infections and save lives. That's why we're here. John, people are starting to see more ultraviolet disinfection. You mentioned that Surfacide does work in the UVC space, the ultraviolet C-band space, which has become recognized as a powerful disinfection option in healthcare specifically. But there are some inherent limitations to UV. It's not necessarily the magic bullet for every application. Can you talk a little bit about UVC technology and what it is and why we're seeing it more in more use today?
Yeah, I'd start off by saying that UVC has been around for over 100 years. And in fact, in the early days, there were different applications. But in the hospital space now, I'll take you back of why UVC actually works. So the different rays of sun energy, UVC does not penetrate the ozone layer. So when we reproduce that light wave, it's 254 nanometers, which is proven to be the germicidal wavelength, that specific wavelength. Then we know that that's disrupting the DNA in all living organisms. Now, that's important also because when you're using the technology, we are a living organism and you don't want your DNA disrupted. So you cannot be in the room while it is being activated. This is very, very powerful. So that would be the first thing. UVC really got some attention when COVID hit, but we're not a COVID company. We've been around for over 13 years. And so what happens is there's a little bit of miscommunication and misinformation that's out there of UVC, how it works and what its limitations are. I would think that the biggest limitation that we see or the biggest misinformation is that just because you brought in a UVC tower or robot into a space, that because that space is glowing with the light, that everything is being disinfected. The only way that UVC works is by what's called direct line of sight. So I use the analogy a lot of times, if you're watering your back lawn and you have a shed and that sprinkler goes in front of the shed, it's going to get the front of the shed wet. But what about the sides of the shed or the back of the shed? Sides of the shed being the sides of the bed, and in OR, the back would be where the anesthesiologist is. So there's a lot of high risk, high touch points that aren't being addressed with just one single tower of UVC.
Let's take a step back because there's a lot to unpack there. I think that was a great overview on ultraviolet radiation because a lot of it started with the sun, right? Everybody's like, oh yeah, UV light, I get sunscreen for that. But the UVC spectrum is not penetrating. So we're not really seeing that from the sun. As you said, the germicidal wavelength that is effective against pathogens. And the Surfacide product uses the UVC spectrum for disinfection, whole room disinfection. You mentioned that I thought it was a great analogy with the shed. So that's what we call shadowing, right? So unless you're getting, if they're shadowing, then the UV isn't getting to the pathogens to disinfect them. And then also you want direct radiation because even though you can get germicidal activity from a reflected UV, the energy drops dramatically, right? So,
That's correct.
So you're not really getting the full effect of UVC. And this is a limitation in some cases for UVC whole room disinfection. Now, Surfacide has some differentiation to overcome some of these obstacles. Is that right?
We do. So we own the patent on a triple emitter system. So we don't have a single robot. We have 3 robots that we put into a room, typically triangulated. And what we do is there is a methodology to it. So the EPA and the FDA guidelines, they want to see what's called a 6-log reduction.
And tell our audience what that is.
And then so for log reduction, what that means is that a 6-log reduction means that there is only 1 or less microorganism that is left on a surface once that room has been disinfected with UVC.
99.9999% effective.
4.49s.
Yeah.
And here's a differentiator for us. And it's concerning because we're all used to the Lysol commercial that says we killed 99.9% of germs on a surface. That's great. That is a 3-log reduction, which means that there's still over 1,000 deadly microorganisms that could be present. And we know from our research that within 6 hours, that those could reproduce to 1.5 million. So if we're really not eradicating that surface the first time, we're really not eliminating that environment as a variable for the patient. Now, the other thing is, we are an adjunct technology to the terminal clean. The EVS teams, they do a tremendous job.
Absolutely.
But we're also asking them to clean the invisible. And just like UVC technology, that's also invisible, right? The light waves. So how do we know that we're giving the correct dosage to get low-level disinfection to make sure that we're eliminating that environment? Well, there's certain technologies out there. This particular one is called a dosimeter card. It only changes color for the amount of energy that is reached to it. So earlier you said, it has limitations as far as how far something is away. So for those of us that paid attention in physics class, it's the inverse, square law that we know that when we double the distance, that it's not half, but it's a quarter of the power. And so the other reason that we're benefit and fortunate enough to have the patent on the 3 systems is that by having 3, we know 2 things. One, that our robots are going to be closer to those fomites, to those all of the pieces that are in the room, number 1. And number 2, we can get a full room disinfection done in just 1 cycle.
Well, I think that's fantastic how you're addressing those limitations. So with using the 3, you're addressing the distance and energy output. You're addressing the shadowing. And are you the only ones using this approach to overcome these limitations with UVC?
We are because we own the patent to it. In fact, we are actually pleased that some of the competitors out there now are recommending to their clients that they run a cycle, move it again, run a cycle, and move it a 3rd time, which is fantastic that they're doing that when they can. But we also know that a typical patient room takes about 15 minutes to hit that 6-log reduction with our technology. So you could imagine if you had to do it 3 times, I really don't think people have 45 minutes to do a terminal clean in a room.
Which is actually standard for most UV robot systems, right? So you're reducing the amount of time, you're overcoming the shadowing. And I think you mentioned something else that I think is extremely important. UVC is a great complementary technology with environmental services terminal cleaning, right? And that is a manual process, and they're highly trained and they're very effective at what they do, but there is the human element. And so then by introducing the non-human UVC disinfection robot system from Surfacide, it really is great complementary to the terminal cleaning that's already taking place.
Yeah, we know that when done correctly and using our system correctly, that we can eliminate that environment from all of those deadly pathogens that are out there. And we hear every day in our hospitals, especially the newer ones when we first get there, that they might be having an outbreak of a certain kind. Mm-hmm. And we have case studies, references, referrals, whatever it is that you'd like to show that we've faced almost every challenge that is out there. And we have the data to show that we're able to help those hospital systems overcome that.
Well, speaking of the data, John, I know you're a lot of fun at parties because you're the only guy I know that walks around with a dosimeter card. Is this part of the process? Are you using the dosimeter cards to determine the location of, if you have a 3-robot system, how do you decide where you put the robots in the room for maximum effectiveness?
No, that's great. So these dosimeters are actually used for many purposes. The first one would be a training tool to make sure that we're able to get over that 100 millijoules of dosage so that we know we're on the right path to getting that low-level disinfection. The second thing that we do is that we use this to validate that our systems are still at the right level and strength that they need to be. And a lot of times what we'll do is we will go into a hospital system that's currently using another first generation technology, and we'll do what we call a bake-off. So we'll ask them to run, we'll have them take 10 of these, put them around the room, in the bathroom, on either side of the beds, and we will ask them to run their system the way they normally would. And then we would collect those cards, and they're all labeled, and you can see it's kind of an eye-opening experience when they see that many of these cards will not change color. And then we will have them
That's
put
the
out
result of like the shadowing or the lack of energy from distance, right? That's
exactly. So we're making the visible or invisible visible to them. In fact, this is such a with UVC right now validating that. We do know that the U.S. government, with all of their VAs, now have a program where they actually have to use dosimeters once a month to make sure that they have correct positioning in all their patient and OR rooms, and that they are still delivering the correct amount of dosage. So dosage is by the power of the machine and then the length of time that it runs. So one of the other things that this leads into is you'll hear claims that we can disinfect an OR to 99% in 5 minutes. That's correct. Probably 99 means that there's over 10,000 deadly pathogens. So it's not about time. It's about patient safety, and it's about a standard of care, right? Why would you do an OR on a Monday and then just do it once a week? Why does that person that comes in on a Friday morning for their surgery have a different environment to go into? Or a patient room? You know, the New York Times just put out an article late last year that said if there's a patient that has a certain pathogen, or a certain disease, fungus, virus, a bacteria that's in a room, and they do the terminal clean, that the next patient to occupy that room has a 584% chance of getting that same pathogen.
Yeah, and of course it varies by pathogen. The statistic that I'm hearing more and more is around C. diff, and that I believe you have an 85% more likely chance of contracting C. diff if the patient who was in the bed before you had C. diff, even after terminal clean.
Even after terminal clean. So again, I would implore you that using UVC technology, and we use it for the right dose, the right time, that we can eliminate that environment as a variable.
Well, that's exciting. We really appreciate fellow travelers on the parallel path of infection prevention. What can you tell us about how Surfacide has been expanding their business? And did COVID have an impact on your business? Or is that because you're not a COVID company, as you mentioned, what was the effect of the COVID pandemic?
Yeah, you know, COVID really exploded our business. In fact, it was a problem for everyone. We couldn't keep up with the orders. And then we found a separate application to where we were running out of N95 masks, right? Mm-hmm. So we know that although UVC doesn't do a great job at penetrating material, cloth, but we know that if we ran it long enough that we could have that effect. So we learned a little bit and grew from that experience. I think it's a great point.
Yeah, because people don't realize that during the pandemic, when there was a shortage of PPE equipment, of the N95 masks, that people were using UVC disinfection technology for, let's call it, off-market applications to actually disinfect those masks so they could be reused because of the shortage. That's not the intended method, but it was quite effective in an emergency situation.
It was, and it also got our foot in the door to have that extra conversation about, you know, really helping to influence, you know, readmissions, influence HAIs and SSIs, again, that's an overall program for a hospital. We are not a silver bullet. We're adjunct to the terminal clean. You still need to have a good hand washing, protocol in place. Are you decolonizing the patient the right way? There's other factors that go in. But again, we can be a very, very effective piece of that program that you would have at your hospital.
Absolutely an essential complementary technology. And again, the terminal clean, really critical because, again, some of the inherent limitations of UV, the shadowing, that also means micro shadows, right? So you have to have a clean surface to make sure you're getting the full disinfection benefits of UV. So following terminal cleaning, best practice. What can you tell us about the future of Surfacide? Anything coming that you can give us a hint about?
Yeah, so we're really excited about some of the upgrades we've done with our software and technology. We have a very user-friendly portal now where the user can not only log the rooms, who did it, when they did it, how they did it, but then for admins, they get a full breadth of all the reporting. That's number one. Number two is that we have a new piece that's called a scrub cycle. So let's say that you had a high profile case that just left the OR, but you don't have that 20 minutes to do the full cycle. Well, we can bring the towers in and in a 5-minute cycle, like a windshield wiper, have all three of them hit those high touch areas that we know are going to be the most, that probably have the most germs on them and bacteria on them, and really knock that down for the next one. And that has proven to really kind of enhance that patient environment for them. So we're excited about that. We also have two other programs. One is, so we're addressing all the surfaces, but we have teamed up with another organization, and we are also doing the air. So we have retrofitted the 2x4 light fixtures. And with that, it has a sealed UVC chamber in it that is constantly doing the air as well. So especially for ORs, it's a great kind of complement to what we're doing. And then a lot of times...
Wait. I want to go back there because that is really exciting. I know a little bit about Surfacide. I wasn't aware that you were getting into the air scrub business, which is so critical because you can disinfect all the surfaces completely, perfectly, and then if you haven't addressed the air, they're going to be dirty again.
Okay. Yeah, we're partnered with Angel Air, and it has been fantastic. So we're enjoying that because we really want to have that full breadth of UVC technology available for our hospitals.
So important that we address all the vectors, right? Hand hygiene is the low-hanging fruit. It's what you hear the most about. But a clean hand on a dirty surface is no better than dirty hands. So you have to make sure that you're addressing hand hygiene, the surface environment, and then the air quality. Because if you miss one piece, then it's not effective.
It's not as effective as it could be, right? But doing those, I think that people will see dramatic, positive results if they have a comprehensive program in place. But a lot of times when I speak to IP or OR managers, they have an outbreak, they have a situation, and they really don't know where it's coming from. Well,
it's the keyboards.
Maybe. So we have a program that's called Path Track, which actually charts and it charts the pathogen from outside the OR to inside the OR, where it came from, who brought it in. It's really interesting. It's a very analytical program where we're asking to take swabs in an OR before the patient comes in, during the surgery, after the surgery, to do 2 consecutive ones in a row. And then those swabs are then analyzed at our lab, and then we can see what is presented on there. But we're also tracking who came in, where they came in, and what the touch points were. So it's a good way to kind of have your program looked at to make sure, is it hand hygiene? Is it that the OR surgeon isn't scrubbing in or maybe too far away?
Or the keyboard.
I think it might be the mouse.
It might be the mouse.
But it's those kinds of things. So we're really trying to be that UVC pathogen fighting consultant for our clients.
Well said, and great information on UV technology and what Surfacide is doing in this space. We are here on site at BAPIC, which is the Bay Area APIC show, the Association for Professionals in Infection Control. Why are you here, John, and what are you hoping to accomplish here at BAPIC today?
So we're here because we do have a strong presence in the Florida market. And so one is to support our current customers that are here and show them that, we're still out here and answer any questions that they might have. But then also for the other members that are here today that might be either using no technology or a first generation technology, we want to have that same educational piece to explain to them what they're doing and then how we could possibly help them out in the future.
Well, John, we appreciate your passion and your efforts in the infection prevention space. Our guest today has been John Guastella. You've been watching Clean Talk. I'm your host, Brad Whitchurch, reminding you until next time, keep it clean.